Welcome back, everybody, to the OPT Network. This morning, we're talking about coronavirus. It is continuing to take lives, over 240,000 people. We thought, we were seeing a decline because I guess the lay people, we just didn't feel like as many people were dying. But give us the truth through your eyes.
Yeah, we also wanted to think that in the hospital. At one point, our COVID admissions got down to 4, which I think is the lowest we ever saw in the hospital. So there was kind of that happy time right in the middle of summer where it was like, maybe it's not going to be what we think it is. Maybe, the death and the morbidity really aren't going to continue. Unfortunately, our numbers have gone right back up.
So tell me what happens like when the hospital was at 4, because a lot of hospitals, especially in Louisiana, I think those numbers went down and we weren't seeing people that got the virus that had to go on a respirator or a ventilator.
Right.
So what happened like when you're down to 4 people? What are y'all thinking and saying among yourselves?
Well, I think, most of the talk in the doctor's lounge was because the entire time our suspicion, and it still is, has been that people get sick based on how much of the virus or the viral load they're exposed to. So our thoughts were people are outside, they're going on vacation, they're doing outside activities, they're more spread out, they're not huddled up in close spaces, and it fits with what we suspect is how the virus works. But we were also hoping, because there was some talk in the New England Journal of Medicine that the virus had mutated to a less deadly form, to put it
and
mildly.
So what does that mean in layman's terms? Because you had people saying, yeah, the virus is still here, but this strain is not as deadly as the first strain.
Right. So what we saw was a difference between morbidity and mortality. So morbidity means you can be in the hospital, you can get close to being on a respirator, you go home with oxygen, you can feel awful for months, but you don't die from the virus. So the mortality we saw going lower, less people were dying from it, but the morbidity was going higher, meaning it's really still affecting people's quality of life, even though they may be surviving the virus, which of course is an improvement from when it started. Mm-hmm. So that's kind of what we're still seeing, but our numbers overall in terms of admissions are going right back up. In fact, the hospital where I work has converted our entire second floor to a COVID unit, basically in anticipation of this winter.
Wow. So what did you learn? What did the doctors learn when you were slammed with the virus and then it came down? You had 4 in there. What did y'all learn about how to treat the patients?
Well, when it first started, as you may remember, the thing that was so horrible is that someone would be talking just like you and I are speaking, and within 24 hours would be on a ventilator because they decompensated that quickly. So we didn't know what to do. It's like nothing we could do intervention-wise would stop that from happening. Now we've learned a couple of things. We have IV Decadron, which is a steroid. We have IV Remdesivir, which is an antiviral. And then we have lots of supplements, vitamin C, vitamin D, and zinc, that have all been proven to lower the mortality of it as far as we know. So basically, as soon as someone comes in, even with mild symptoms, if they're a little bit short of breath, we don't wait for them to decompensate. You're getting the kitchen sink as soon as you get admitted, because the earlier we can intervene, the better people seem to do. And that's what we've been doing, pretty much ever since a month into the pandemic. So I think some of it, go ahead.
But here's the thing, like when people initially got the virus, they were saying, don't come to the hospital. There's nothing we can do for you.
Right.
People were coming like in the worst case scenario, like they couldn't breathe. What are we saying now to patients?
If you have any symptoms, you need to either go to your primary care doctor, an urgent care, or a hospital, because there are early interventions that you can be prescribed now that will help. You may not be admitted to the hospital. We do still send some COVID patients home, but there are definitely prescription medications and education that we can give you and your family where you will do better than before. So I recommend please seeing your doctor if you have any symptoms at all.
Right. So we just had one of our son's friend's dad that died from the virus. And
Oh,
I'm
I'm sorry.
wondering, yeah, and it was just really sad. I'm wondering, like, do we have a grasp on why some people die? I know about the comorbidities. I know about, the weight and if you had high blood pressure or if you had some underlying issue, but anything beyond that, why some people can get it and it's just mild and then other people get it and they just don't come out of it.
It's really hard to predict. I think that's the insidious nature of this virus. But I really do think it's tied to viral load. So what I mean by that is if you have more than 10 minutes of exposure within a close distance of with someone who has COVID, to me, you're more likely to get a more virulent strain, a sicker illness than someone where you may have both of you are wearing masks, but somehow you came across each other in the grocery store and you got exposed to a lower dose. Mm-hmm. So for me, I think it's all about exposure and how exposed you were when you contracted the virus. So going into the holiday season is really difficult because I totally understand the sentiment of time with family is important and none of us are guaranteed any time on earth. I get that. But with the Thanksgiving holidays coming up, you have to know within your little pocket of people who is practicing safe protocols and who isn't. Because if you're sitting at the dinner table with someone for an hour with close proximity and no masks, and they haven't been practicing good protocols, you could get very, very sick from that.
And don't you think we've all kind of gotten a little bit laxed where now we're starting to congregate with our family? And, before you were staying at your house and I was staying at my house and we would FaceTime or we would talk, but now we're coming together. And The holidays is a time where not only you come together with your family, but you come together with your extended family.
Yes, and it's very difficult because we've all had a tough year. We're ready to be together. We're ready to love on each other. We're ready to celebrate. But I would really warn people, it's about to be cold again. We're going back to indoor activities. People aren't going outside. We're breathing the same recirculated air. Extended family are probably traveling on planes. You've got to assess the risk and decide if it's worth it. There are ways to get together, maybe unconventionally, and see each other. But you have to weigh the risk of, do I really want to sit down at the dinner table with someone who just came off a plane, knowing that I could get very sick and I could die from this virus? And we also have flu season upon us. And the last thing we want to deal with is a twindemic, dealing with flu and COVID, because that's going to be insurmountable.
And so let's talk about flu season. It's upon us. How now do we know, do I have the flu? Because now anytime you cough, especially if it's a dry cough, you're wondering if it's the virus. How do we differentiate?
You can't. You have to be tested for both. The symptoms are very similar. The good news is we have great treatments for the flu. So most of our screens in the ERs and urgent cares are actually testing for both at the same time now.
Mm-hmm. And what about the flu shot? What are you saying about the flu shot?
Please get your flu shot. We only have a widespread, well-known vaccine for one of these viruses. So if you can protect yourself against anything, please protect yourself against the flu, because we know that even if it doesn't save you from getting the flu, it will save you from dying from the flu. And that's what a flu shot does.
Wow. And so on this journey, and I know you have a beautiful new baby that's probably almost a year old.
He just turned a year old.
Okay. He just turned a year old. And you were, all in with saving lives, being in the hospital. How have you been able to protect yourself and your family and your little one?
We actually have a pretty good system in place now. He stays with us as long as we can take care of him. But when I have to go to work, he usually goes to one of his grandparents for a few days. Thankfully, we have a lot of support. And before he comes back to stay with us, I get a COVID test to make sure that I'm negative. And then we kind of resume normal family life. So I'm getting a lot of swabs on my nose because that's the only way to know.
So Dr. Jaya, how have you been able to to deal with your mental health and well-being, knowing you have your baby and your family, your parents, and yourself, that you are every day exposing yourself? How do you deal with staying sane and not worrying yourself that, will I be exposed today?
Well, relying on the people I work with has been pretty instrumental because they're really the only ones who can understand what this stress is like. And so we have kind of our own support group. But also, the company that I work for has been very aggressive in encouraging us to get outside counseling and treatment and Zoom calls with a therapist, even if we feel like we don't need it. Because once you start talking, you always unearth things that you didn't realize you were grappling with. So I have absolutely zero shame in accepting help right now, or in general, honestly, because I know that unless I have processed everything that I'm going through, I'm no good to my patients or my family. So mental health is very high up on my list right now.
And have you dealt with the death that you've seen? I'm sure, as long as you've been a doctor, have you seen this many deaths this close together in your career?
No, I honestly haven't. The only time I dealt with death this much is when I rotated on the hospice service, which is a little bit different. So I can't say how we deal with it. I think that the most frustrating part of this is watching people have to be alone and fighting to make sure that our patients aren't alone as they're suffering. Our hospital has been great. If we know a patient is probably not going to survive, we've been making special exceptions to have family come in, for people to be with each other as much as possible. But it's still very, very hard to watch people die from a disease we still don't fully understand. And sometimes it's young people with no comorbidities that you wouldn't expect. And I think that that's the most difficult part.
So walk us through the process of those last hours of a person's life. And you said, when we kind of know, how do you know that the body, because I've, we recently read an article of somebody who stayed on a respirator for 30 plus days, I think, or somewhere thereabouts, and did come out of it. How do we know when death is becoming imminent?
Well, the first difficult conversation we have to have with people is we do everything that we can to not put you on the ventilator. Because unfortunately, what I would have to say to any patient, if it was your family member, I would have to say, look, Carlette, we're going to do everything for your loved ones. But if it comes to the point that he or she goes on the ventilator, there's a very good chance that you won't be able to talk to them. They may not survive, because at the point where you get on the ventilator, it's a 40 to 50% mortality. That's a 1 in 2 chance.
Are people saying to you, Dr. Jaya, whatever you do, don't put them on the ventilator?
Yes, people are telling us that, because a lot of people have that wish to not be on life support, especially if it's going to be a poor prognosis. And there are some things that we have now that we can try before putting on a ventilator. We didn't have that understanding before. But to your question, whenever someone is on a ventilator and their lungs are so damaged that they're not able to breathe over the ventilator, meaning the ventilator is doing all the work, and a lot of times other organs start to shut down. The kidneys are something that we see fairly often. It's at that point we have to approach the family and say, it doesn't look like your loved one is going to survive this illness. And we really need to talk about what their wishes are, if you know, about how they would want this to go. And that is so difficult. None of us have mastered that conversation. I mean, how can you have that conversation with someone who was walking and talking a week earlier, and now you're asking them to decide, how do you think they would want the end of their life to go? Wow. But these are the questions that you have to know about yourself and your loved ones if you're going to deal with this virus. So it's a conversation I urge people to have with each other, because what I'm seeing is families don't know. They don't know what mom or dad would have wanted, and it's killing them to make that decision.
And so in that moment, the family is, you're with the family, so are they like trying to decide, do we just go ahead and take the person off of life support and let the natural progression of death happen? Or do we
Right.
just continue, or is the hospital saying everything's shutting down, we need this ventilator?
Well, we do have some LTACs, which stands for long-term acute care facilities, that will accept patients if the families decide they want to stay on the ventilator. The main thing is if the body's completely shutting down, at some point their heart's going to stop. So do you want us to continue to do chest compressions and crack their rib cages and shock them, trying to bring them back to life? Or do you want them to have more of a dignified or peaceful passing? There's no right or wrong answer here, but there are decisions that have to be made. So I think if someone wants to stay on the ventilator and that's the decision the family has made, we do try to get them placed in a facility where they can go and have that care.
So how long have you seen people, Dr. Jaya, that are able to sustain themselves? What's the average time that a person can be on a vent and come off? Since you've seen sort of the pattern, or is there a pattern?
With COVID,
With COVID.
COVID doesn't want to follow any of our understood patterns.
Wow.
But in general, and this is something I think across the board, within 96 hours, if a patient is able to be weaned at all, if they're able to require less oxygen, if they're starting to breathe over the ventilator, it's a more favorable prognosis than if after 4 days there hasn't been any improvement. Unfortunately, at that point, I would say to the family, I'm not God. I cannot predict what's going to happen. But based on what I know, I don't think your family member has a good chance of surviving this.
Wow. Now, when they were trying to figure out all of the logistics and things that would work, one of the things that they talked about was flipping the person over on their belly.
Yes.
Has that been something that has been tried and is helping?
Yes. So we call that laying the patient prone. And it does allow the lungs to get more oxygen than if they're laying on their back. So in any patient that is able to do that, we absolutely still do that. Yes.
And so some of the patients, are they unable to be face prone?
Yeah, whether it's due to size or anxiety or maybe a physical debility, not all of them are able to do it. And so we certainly don't want anyone to be more uncomfortable than they already are. But even 30 minutes, even if they can do it for 30 minutes has shown to be helpful. So we just do what they can.
Are patients alert when they're on the vent?
Most of the time, we like them to be alert because we can communicate with them how they're feeling. But as you can imagine, being on a ventilator is quite anxiety inducing and unnatural. So many times their blood pressure or their respirations will go up just because of the situation. So we put those patients on sedation so that they're not suffering.
Wow. So on this journey, Dr. Jaya, have you been journaling? Have you had time to go back and assess everything that you have had to endure in trying to save lives? I mean, you became a doctor because you wanted to take care of people, but probably in your never in your wildest dreams could you have imagined that you would have lived at your young age and at any age through a pandemic.
No, I think I was journaling a little bit at the beginning, but now between work and baby and family
and life,
and life in general, there's not a lot of time. I honestly think when this is over, and God knows we pray every day for it to be over, I'm going to need like a day-long session with a therapist to unpack all this, because I honestly think most of us, even though it feels like this is old news at this point, even though it just started in March, most of us are still in survival mode. That fight or flight. We get to work. It's like we have emotional blinders on. We can't deal with all that because we've got to get the job done. And then we just want to get through work so we can be home with our families. So I don't know that many of us are at a point where we've processed any of what's happened because we never got a break.
Sure.
We never got a break from it.
Sure. Have any of your colleagues gotten the virus?
Actually, our chief did. He did get the virus. He's the only one. We have 11 or 12 physicians on staff. So he had to quarantine for 2 weeks. Thankfully, his case was relatively mild. His only symptoms were severe fatigue and fever. But the rest of us have managed so far to stay virus free. And I'm very thankful to our facility because we've had PPE every time, and there hasn't been a shortage. And I know that's not the case everywhere. So I'm very thankful for that.
Sure. Before we've got to let you go, Dr. Jaya, I want to circle back to Thanksgiving and even Christmas. As a physician that has seen more cases of COVID than you probably care to, what's the most important thing that you want people to know about these gatherings that people are going to have? These in-person gatherings.
Yeah, absolutely. I think that if you're in person, everyone that's attending to the gathering, you need to have a very frank conversation about what protocols have you been following? How seriously have you been taking this virus? Because I will tell you, the people that come in that get very sick, what they're saying is, I have been so careful, but I just wanted to see my loved one for that birthday party, for that one church service. I just let my guard down once, and that's how I got sick.
And so let's talk about letting your guard down. What does that mean?
Letting your guard down means making an exception for everything that you've been following. So many people have been quarantining, masking, and social distancing, but I just want to hug my family. I just want to sit down and have a normal birthday, a normal dinner. And then that's where they get it, because the virus is spread through us talking. It's in the air. It's in our droplets. So I would just weigh the risks and benefits, because you can sit outside, socially distance, and see everybody and spend time together rather than sitting close knit at the dinner table inside with no masks or social distancing. I would urge you, there are ways to see your loved ones safely without compromising your health, because you do want to be here Thanksgiving 2021.
Absolutely. And Christmas as well.
Absolutely. Yes.
And so with Louisiana weather, we really haven't experienced any winter-like weather yet.
Right. Exactly.
So outside could be a good option.
Get a picnic table. Everybody sit outside. Depending on whether people are flying in or not, they could be at a separate table. But there are ways to lay eyes on your family members. There are ways to share food, to do a potluck safely without compromising your health. This is too important. And all of us are making these sacrifices too. I may not see my sister because she lives in New York, but we just have to talk about, listen, we've got high risk people. We love each other. Let's do what it takes to be together and also to see each other next year. Okay,
one other thing, people that will be flying in, what needs to happen? Do they need to sort of be in a quarantine type atmosphere before they join the family, or how should that work?
Yeah, I would recommend finding out where you're going, where the free testing is, scheduling a test within 2 to 3 days of you landing, and quarantining until then. It's not perfect, but it's safer than not doing those things. And you can get free tests at CVS.com and online with Walgreens. And here in Shreveport, we have free testing almost every day through Ochsner. So there are ways to mitigate the risk if you're going to get together. Just be smart about it.
So if I get tested, if I'm on a plane and I get tested, when I land, if I have the virus, if I'm carrying the virus, will it pick it up instantly? And how long will it take to get those CVS tests back?
So actually the ideal time window is 3 to 5 days after you land. Now, that may be the entire trip for some people.
Right.
They may just be flying in for a day or two. So all I can say is if you can get a test within 24 hours of arriving and then practice social distancing or masking until you get the test result back, that's still not 100%, but at least you have an idea of whether there's enough virus in your nose to actively infect people.
Wow. Dr. Jaya, you are absolutely the best. Thank you for taking the time, and thank you for doing the hard work of saving lives and comforting families through this most difficult time.
I really appreciate that. And just trust me, all of us want what you want. We want everyone to be together and safe. So please just do what it takes so we can all be here celebrating later this year and next year as well.
Absolutely. Dr. Jaya McSharma has been our guest. Everybody stay on point. We're back after this.